Hello, everyone. My presentation today is on exercise prescription for healthy populations with special considerations. So these populations include children and adolescents, ages 6 to 17 years old, populations with lower back pain, older adults, which are older, equal to or greater than 65, or 50 to 64 with clinically significant conditions or physical limitations, and those that are pregnant. First, we'll go over the recommendations for children and adults. So this gives the FIT guidelines for aerobic training, resistance training, and bone strengthening for children. Um, Most of the current individuals of this age do not meet the prevailing guidelines, so they aren't meeting the 60 minutes a day of physical activity. Excess screen time has been linked to increased adiposity, decreased fitness, elevated blood pressure, blood lipids, and elevated glycohemoglobin levels in youth of this age. Um, Most importantly, the physical activity and sedentary behavior patterns of children often move into adulthood, and so it's vital to initiate that physical activity at an early age. The benefits of exercise at this age are much greater than the risks, and recent evidence also supports that the concept of physical activity and physical fitness are positively associated with cognitive and academic achievement. Um, Exercise testing is done at this age, however, it's not generally indicated unless there's a health concern. Um, Most exercise prescription, the type of activity, it should be something that's enjoyable and age appropriate. So anything that gets the kids outside. If they're not involved in sports, then outdoor activities or playing on a playground, climbing. It can be unstructured or structured. And then need to focus on bone strengthening, which most of the aerobic and resistance training will already be incorporated in that and encourage that bone strengthening. Um, Strength training can be participated in as long as they have proper instruction and supervision. You need to be aware of this population's immature thermoregulatory system. So making sure that they're not doing heavy exercise in hot, humid environments, properly hydrated. Um, those that are overweight or physically inactive may not be able to achieve that 60 minutes a day, so just gradually working their way up to it. And all efforts should be made to decrease sedentary activities, right? Like web surfing, playing video games, and try and increase those activities that promote lifelong activity and fitness. The next population that we're going to talk about is low back pain. Low back pain is defined as pain, muscle tension, or stiffness localized below the rib margin and above the inferior gluteal folds, with or without leg pain. It's a major public or health problem, and anywhere between 4 and 33% of the adult population will experience lower back pain at any given time. So, what I got from this section was that every person is different, that you should start with the fit recommendations of the general population, that most back pain is resolved within 6 weeks, regardless of treatment. Staying active is most important within pain limits to avoid bed rest after injury, and returning to work is the best medicine. And a combination of therapeutic and aerobic exercise in conjunction with pain education improves attitudes and thresholds of pain. Um, the psychosocial factors for long-term disability and work loss associated with low back pain are negative attitudes that it's harmful or potentially severely disabling, fear, avoidance, behavior, and reduced activity levels, an expectation that passive rather than active treatment will be beneficial. A lot of people stop working out or stop doing any physical activity, which doesn't help the problem. And a tendency to go into depression, low morale, and social withdrawal, or their social or financial problems. These increase the risk of perpetuating that long-term disability. Current literature doesn't support a definite cause for these initial bouts of low back pain. From my experience, low back pain is so different from one person to the next. But current guidelines do place a heavy emphasis on preventative measures, early interventions to minimize the risk of low back pain, and the current best evidence supports that lower back pain, to treat it, is to use physical activity to manage the condition. And then individuals in this category usually have deficits in the trunk muscle strength and endurance and neuromuscular imbalances. So that is one thing in the exercise testing and special considerations to go over is doing a individualized test and trying to figure out how these work for individual people because everyone's different. Special considerations is trunk coordination, strengthening, and endurance exercises can reduce that lower back pain and disability in adults. So just encouraging more of those exercises, taking into consideration individual response to back pain symptoms. As I said, everyone is different, and you'll just have to modify as symptoms come. And certain exercises aggravate it, so you want to try to avoid those exercises. The next population of people are older adults. So older adults are any individual equal to or greater than 65 years old, or individuals that are 50 to 64 with clinically significant conditions or physical limitations. So the biggest factor in this age group is that progression should be individualized, especially for those that are deconditioned, because people in this age group vary on strength, they vary on muscle, and they vary on coordination and balance and all the other aspects of fitness. So it's difficult to distinguish the effects of aging on their function because you never know where they're coming from. So it's important to interview your client and get to know them and start light, a small workload, and use senior fitness testing when necessary to determine where they should start. When they get to this age, especially over 50, resistance training is more important, and power training may actually be particularly beneficial. Adaptations for each client may be necessary, especially those that don't have the balance. So you may need to use a cycle a cycle bike instead of a treadmill, or make sure that the treadmill has handrails. The treadmill work may need to be adapted with grade rather than speed for those. And then, like I said, the senior fitness test is a good assessment. There's also other senior tests or performance tests that can be done for this age or this population of people. Structured physical activity sessions should end with an appropriate cool down, especially among individuals with cardiovascular disease. Cool down should include a gradual reduction, effort intensity, and of course, optimally include flexibility exercise that slow movements and terminate in static stretches. And the last population of people are pregnant women. So during pregnancy, you just need to be aware of warning signs and contraindications for exercise, and any medical complications that they have, having them fill out a specific pregnancy PAR-Q, or it's called the PAR-Med-X for pregnancy, so you know where they are at, what kind of medical complications they may have had. Make sure that they get clearance from their physician. If they have exercised before or have been exercising currently, and they don't have any contraindications, then it's perfectly fine for them to exercise with their doctor's consent. You can start them. Of course, it's actually encouraged. Consistent exercise for healthy pregnant women is encouraged due to long and short-term health benefits. It's also encouraged for those that haven't been exercising, and in that instance, you would use the same fit recommendations as healthy adults, or you would start them progression. You would start them slow, take it easy, increase the intensity and duration over time as they get stronger. Exercise testing is not recommended for this population, and Kegel exercises and pelvic floor strengthening is recommended so that they can maintain bladder control. And there are special considerations for this population. So after week 16 of pregnancy, physical activity in the supine position should be avoided due to the weight of the growing fetus. So it may reduce venous return and cardiac output. So pregnant women should avoid exercising in hot, humid conditions and stay hydrated at all times and dress accordingly. And during pregnancy, metabolic demand increases by about 300 calories. So they need to increase their caloric intake to meet these in order, and then, but not go above or below that recommendation. Going above could increase weight gain and cause other medical problems. Physical activity may help regulate weight gain. However, women who exercise above the levels need to make sure that they're getting adequate calorie intake. Those that are severely obese or have gestational diabetes or hypertension should consult their physician before exercising. Of course, contact sports should be avoided, and any activity using the Valsalva maneuver or prolonged isometric contraction and motionless standing should be avoided when pregnant. And physical activity after pregnancy should be done gradually with doctor's consent. Normally it's 4 to 6 weeks after a normal delivery or longer for cesarean. But those that have a higher cardiovascular fitness can sometimes come back a little sooner with their doctor's consent. Well, I hope you enjoyed my presentation, and I'll see you next time.